is Liza Greenberg with the Patient-Centered Primary Care Collaborative. I'd like to welcome you to our first Pediatric Learning Network call. We see a lot of people who are still joining the call right now, so we're going to wait one more minute and then we'll go ahead and get started. Okay, well, we still have some people joining, but I think we'll get started. Again, welcome. This is Liza Greenberg. I'm the project director with the Patient-Centered Primary Care Collaborative Support and Alignment Network. And this is the first call for the Pediatric Learning Network, adopting patient and family engagement strategies to improve pediatric asthma care. So we're delighted to have with us today an expert in quality improvement in the pediatric setting, Rhys, and she will be joined by a pediatric clinician, Dr. Lilia Pararoyd, who is with Dignity Health in Arizona, and I'll be facilitating today's call. I also wanted to let you know who else is on the call today. We're really pleased that there's been such an interest in the Transforming Clinical Practice initiative in the idea of using person and family engagement strategies to improve asthma care. So with us today on the call are about 50 clinicians and quality improvement specialists. We have about 20 pediatric office staff, pediatricians, nurse practitioners, and other clinicians, as well as about 20 practice improvement coaches and facilitators from practice transformation networks, and another 10 to 15 national organizations and practice transformation network staff. So what we're here to do is to hopefully reduce hospital admissions for asthma, and our strategy will be emphasizing person and family engagement tactics to reduce hospital admissions, and that's by engaging patients and families more effectively in asthma quality improvement and asthma self-management and other tactics that can help to reduce that pediatric hospitalization issue. So what we'll do today is look at person and family engagement practices overall. We'll talk about the specific measures that have been adopted by the Transforming Clinical Practice Initiative, or you may hear us call it the TCPI. We will hear from Dr. Pararoyd on her strategies for using person and family engagement to improve her practice outcomes, and then talk a little bit about the specific tactic of engaging patient and family voices, so involving patients and their families directly in how to improve quality and how to manage a practice more effectively to activate patients and to improve quality. And then we'll look at some of the tactics around identifying patients with asthma, resources that are available, and come up with some action plans for what organizations will do in between the calls that are part of this learning network. And it is a multi-part strategy that we're using here. So today we'll talk about patient and family voices and kick off the initiative, how we'll look at quality improvement tactics to improve asthma care for patients. And then we'll continue with the series around different elements of person and family engagement. So our next call on June 20th will look at shared decision-making, specific patient activation strategies, health literacy, and medication management. And that theme will carry through into our third call. Then we'll follow up with communicating with patients using e-tools and other communication strategies, and then end up with connecting patients and families with appropriate supports and services. And as I mentioned, in between those, hopefully each one of you will commit to action steps between the calls, and we can decide as we go forward whether it would be helpful to you to have office hours or some kind of way that you can engage with Ruth and our quality improvement staff to continue to keep things moving on your quality improvement approaches. So I'm going to turn it over to Ruth in just a moment, but I did want to mention that we're hoping that everyone will be able to ask questions and really engage with challenges or issues that are specific to your practice. Right now, everyone is muted, But by the end of the call, we'll unmute everyone and we'll ask you to sort of bring up your issues or things you'd really like to talk about, or if you have effective programs that you'd like to share with others, we'd love to learn about those. So for now you're muted, but you'll see that shortly we'll take that muting off, just trying to reduce the amount of interference we get on the voice part of the call. Also, if you do have an important question that you'd like to ask before we open up the call, you're welcome to use the chat function on the side of your screen. So just kicking us off on the measures part, for those of you who are part of the Transforming Clinical Practice Initiative or who are enrolled with a Practice Transformation Network, these may look familiar. These are the TCPI Person and Family Engagement Metrics. And there's 6 of them that really outline an overall strategy for engaging patients and families in a way that helps activate them to be partners in care and to take a role in clinical management of their conditions, which we think translates into improvements for pediatric asthma. So today we're going to focus in on metric number 1, which is support for patient and family voices, which means really figuring out ways to involve patients and families in the policies and procedures, in direct quality improvement activities, and things that make the patients and families really a part of the overall care team. And again, as a way of hearing patient voices and hearing what to them would effectuate quality improvement. And as we proceed through the Learning Network, we'll talk about the other metrics, which are shared decision-making, patient activation, using e-tools and communications, health literacy, and medication management. And sort of how that all fits together is illustrated in this algorithm here. This is the National Heart, Lung, and Blood Institute asthma care algorithms, and we've kind of mapped that to the TCPI Person and Family Engagement metrics. So the point we'd like to make is that person and family engagement is not something separate you do from your overall asthma management strategy. It really contributes to that quality improvement and to making the outcomes better for patients and families. So for example, for involving the patient and family voices, you'll see that that really helps you make your office more engaging to patients and families. It helps improve retention, gets people coming back and wanting to be a part of the healthcare team. And I won't go through all of these things, but we'd like to just illustrate that when you put all the elements of person and family engagement together, it actually contributes to your quality improvement goal. And with that, I'll turn it over to Ruth, who will talk us through some of the very specific quality improvement strategies.
Thanks, Liza. Good afternoon, everybody. Thank you so much for taking the time to work with us today. I've been a quality improvement advisor and coach and practice facilitator and transformation coach, working with primary care practices, including parents and caregivers and patients, primarily in pediatric practices for more than a decade. I've been honored to be able to do this work with organizations such as the American Academy of Pediatrics, and now with all of you, to be able to help improve patient and family engagement. Next slide, please. I really like this definition of patient and family engagement. I'm sure you're all familiar with it. It's from HRQ. And just the fact that it talks about it being an innovative approach. It really is about doing this as to be able to put new systems and improve systems of care that are grounded in mutual benefit partnerships among the healthcare providers, patients, and families. And it's about, we all know that patients and families need to be actively engaged at all levels of healthcare, including those in the pediatric primary care practice. And we need to ensure that there's a free flow of information to and from the patients and families in an environment where the patients and their families, their parents and their caregivers, are always treated with respect and dignity. It's about engaging patients and families in their own care, in the practice improvement, as Liza mentioned, and in policy at various levels, including the practice, the hospital, and the community where they live. Next slide. So I just want to remind you that this is all within the framework of quality improvement, different from doing research. And I hope that you're all using a quality improvement methodology such as the model for improvement, because it's about taking, using rapid cycle, small tests of change, and it may be the next patient that you see who's been diagnosed with asthma and their parent or caregiver, someone that you may see tomorrow, that you're going to do something a little differently so that you'll be able to engage them in their own care or in your practice improvement at the practice level. Next slide, please. And I like this slide because it can define the various types of improvement in quality improvement. It could be something that's just occasional input being given by patients and families to being really active team members, which is really the goal. This is what we want to see. But along that continuum of being able to, even the family, the patient and family filling out a survey for you has value. It's seen as the occasional input. And moving all the way to the point where there are some practices now, pediatric practices that I've worked with, who have paid staff, not the member of the staff who also happens to be have a child or children in the practice, but paid staff who actually have that role and responsibility as the voice of the patient and family, and involved. They're the ones who may be coordinating the care for the activities for such things as the advisory groups, or just being able to keep that voice always present on the team. On the next slide, this is a great visual because it shows you that there are various levels of patient and family involvement. And this is from the Patient Engagement Toolkit from the Partnering with Patients initiative from the University of Wisconsin. And, you know, it may be, if you look at that low level, at level 1, that's where, you know, the practice team is just sharing information, informing or educating the patients and families. Level 2 moves on to where there's information gathering coming from the patients and families to the, you know, to the healthcare providers. But where I'd really like you to focus and consider, you know, really identifying where you or your practice teams are, start, you know, look at level 3, where it has to do with discussion. It's about talking with patients and families about asthma care, seeking clarification of feedback, soliciting and sharing improvement ideas. Or it may be level 4, where there's more engagement. It may be looking at engagement as advisors, but there the engagement may be only when there's input that's deemed valuable by the practice team. But really the goal of this is to be able to have practice teams be, and patients and families be at level 5, fully engaged from the start as full members of the team. I like that there's no big, you know, the large circle is gone. Everybody is fully equal, and there is really partnering going on. So I encourage you to take this visual and after this call, ask folks where they are today, because I know that the hard work that's going on for this initiative and others, there is, you know, a real need to reach level 5, but it's also really important for the practices to understand and the families where you are today so that you can move towards that partnership in the future and not be disappointed because it's too much to just ask to start at level 5. So with that, I see that Dr. Pararoyd, who's going to be sharing her some of her experiences with us today, will be joining the call in the next few minutes. She's currently on another call. So I'm going to just jump ahead and then come back because she has a lot of good information to share with you. But let's focus on something that I want to talk about as an action step. We talked about, taking some of the information from today's call and really using it and moving forward with practice teams. And so this kind of engagement with patients and families in conversation related to their child's care is that level 3 space on the continuum. It may be the use of pre-visit contact forms, such as those that are available through the AEP Bright Futures program for well visits as part of at different ages. But it could be related to discussing family strengths, or specifically, since we're focusing on asthma, the asthma control test as an opportunity to be able to assess and have a conversation with patients and families. And this is a tool that we have posted for you, and it's readily available, and you'll be able to find it after the call on the website, where I encourage you to take a tool like this and plan a test of change, maybe with the next patient with asthma and their parent or caregiver, with the practice or practices that your practice or practices that you're working with, and think about how you can test the use of this if it's not something that's happening routinely now in the practice as part of asthma care management. Some teams I know I've heard, they try to use it. It's used sometimes. It's not always something that's done successfully. So think about doing it as a test of change. You may, as part of your plan, it may be that the front office is the one who's sharing it with the patient and the family. The one with the pictures is for younger patients, for those 4 to 11. The other tool is for those 12-year-olds or 12 years old or older, and it's available in English and Spanish. The team who's a little more advanced and has a patient portal, and you're thinking about how can you engage families in the use of the portal, well, this may be something that you use your secure email and tell them to go to the portal, and that this assessment is available for them to fill out prior to coming in for their visit. But the most important, a very important thing I want to share with you is that it's really great and important to solicit informal feedback from the patients and families and from your staff, the physicians and staff who are actually testing the use of the tool, because you're going to get that important information back about how useful or maybe opportunities to help make it work better, so that it really can be something that you can use to build relationship and a better partnership with the patients and families that you serve. On the next slide, here's another example. This is the AEP's Bright Futures Eliciting Parental Strengths and Needs handout. That again, we have a link to this. It talks about it being used for a family who has a child with special healthcare needs. Remember, the patients diagnosed with asthma fall in that category. And again, this can be used as a plan test of change. Even in a small practice where there's one physician or maybe a physician or provider and an MA or the team or the practice staff and the team, still possible to be able to test this with the next patient with asthma and their caregiver who are coming in for that visit, either in an office or through the portal. And it's an opportunity then, again, to solicit parent, caregiver, patient feedback and staff feedback about comments about, how did that work as part of the visit? Was it useful? Did it help be able to engage with conversation and discussion about the importance of doing this work? I like this tool too because it also has a pre-visit checklist where a parent can identify what they do well as a parent in addition to things that they may want to discuss as part of the visit today. I see that Dr. Pararoyd has joined our webinar, so I really want you to be able to hear from her. And so I'd like to introduce her. She is a practice champion who has volunteered to be our first pediatric practice innovator for this month's call. And she is the chair of pediatrics and the medical director with the Dignity Health Medical Group Pediatrics, which is part of St. Joseph's Hospital and Medical Center in Phoenix. She's part of one of the practice teams that's been working with the Arizona Practice Innovation Institute on transformation. So Dr. Pararoyd, if I could turn this over to you to please share a little background about your practice and your successes and challenges and lessons learned with your use of this asthma data collection tool.
Okay, thank you very much. I'm going to actually probably hold the phone up, so let me adjust how I'm talking so that I'm not turning my head to, and you can all hear me. Okay, can you hear me?
Yes, can hear you well, thanks.
Okay, so yes, I'm in Phoenix, Arizona. I've been here for 25 years, and I actually developed an interest in asthma through my work with the Inner City Intervention Program beginning like in 2001. It was at that point in my career, I was a project manager for that, and I was overseeing the recruitment of children with asthma. And this was outside of our own practice, but that's when I became aware how, you know, all the areas that we needed to improve in our practice. And so it's been a journey of trying to get better in the practice setting. And a few years ago, Arizona participated in the AAP Chapter Quality Network. It was phase 3. And so we were the third year. I don't think they were serial years. There might have been some skip years, but in that process I was asthma champion. And this form that you see in front of you was the encounter form that we would use, that we encouraged the practices that were participating to use to collect data. In the process of using it, I discovered that my patients were much more engaged in the problems that they were having. It's interesting. So this form is designed to be given out at the beginning of the visit. So in a practice setting, this could be at the time the patient checks in. You can maybe, you know, as I was talking before, use it through a patient portal if you decided to send a link that way. But in our practice, we were giving it out at the time that they arrived here, and they would fill it out while they were waiting to come into the room. And the first question I got from some of my patients is like, well, oh, this is the same form I filled out last time. Why are you having me fill it out again? And the key here was, you know, these questions are always the questions we're interested in. Your asthma is a disease that varies depending on the time of year. And the answers to these questions won't stay the same. And it is really important for you to monitor these types of symptoms on a daily basis. And the fact that you fill this out here every time will make you more aware of these things. And if you have any questions, we can discuss them. And so I also gave them the asthma control test. So they would fill that out because that's a validated questionnaire. It's got a CPT code associated with it. And so it allows you to collect validated data. And sometimes the questions in this form and in that, some of them are similar, but there's nuances in ways that are different. And it always allows for you know, extra insights when there's answers that vary between one and the other. So this one goes more into details about
quality of life issues such as missed school days and also missed work days for their parents. And it also allows you to assess risk, which the asthma control test doesn't do. It asks about emergency room visits and hospitalizations. And let me see what else I wanted to point out about this form. It also has them rate their comfort level with managing their own asthma or their child's asthma. And so that's very helpful as well, particularly when you see a disconnect between, what they're saying and how they're rating themselves, and, how symptomatic their child is and how comfortable they are. And sometimes they're actually not well controlled, and their perception is that the asthma is very well controlled. And so these are very interesting conversations that I've had, and I think there's a mutual satisfaction with the use of the form, and when parents come back, they answer the form very quickly now, and so there's been general acceptance for it, not only among the patients and their families, but also with other providers in the office that use it. So, do you have any questions about the form?
We're going to open up the group for questions towards later on. But if you have any, please put them in the chat box.
Okay.
So I love the way you had told me too that being able to use this form has really helped you have that conversation. So families you get rid of the myths that many individuals have about asthma.
Yes, and there's times, because it also asks, do they have their spacer, are they using it? So it also allows you to ask about the way they're using their medications on a daily basis. And then this physician section is a part that we fill out in it, and once we're going through this, then we're basically doing all the guideline-based care. We're using the NHLBI control tables to assess whether we're, what their severity is, if it's an initial asthma visit, but also whether we can step up or step down if it's a follow-up visit. And as we go through these things with the family and also their asthma management plan, or their action plan, whatever you like to call it, there's also another discussion, about like areas to focus on as far as managing their asthma in a better way. And I think through the conversation, many things come along, like when you're asking about how asthma interferes in their daily life, the key there is trying to make a linkage between your plan, the plan that you want, and what their goals are, because it's about helping them lead a healthier life. So, and that's the same thing that principles that would apply to assessing the triggers, and then trying to come up with, doable actions to help reduce exposure to triggers. So
great. Thank you for sharing that. Did you find that you were able, as part of the collaborative or beyond, that you have any, any data about changes in emergency department use as a result of tools like this?
I am trying to get that data to see if this has actually made a difference, but I haven't been able to assess it like directly. So I can't tell you at my practice level whether I've seen that or not. I like to think that it's definitely made a difference, but I haven't been able to see the data that links up, to the patients that I've used this with. So I don't have that.
Okay, all right. Well, thank you. You've given us a lot of good insight to the use of, how this has really helped your conversation and building the relationship with your patients and families. Thank you.
Yeah.
One thing I noticed, this physician section, keep in mind, that all of you, you need to be able to identify, the practice needs to identify who are their patients with asthma. That's often missing. This is a perfect template, a good template to use for an asthma registry. So that it has not all of the elements you would need, even if it's an Excel spreadsheet. Really useful then to be able to track even things like ER visits and the follow-up, that whether or not follow-up happened because the patient had been seen in the ER. So, and if your patients are being co-managed by other specialists, do you have what you need to be able to co-manage that patient? That's another thing I think is a useful reason to consider reviewing with practice teams a tool like this.
Yeah.
Thank you so much. Thanks
You're welcome.
for sharing. Great. So we can move forward. So that was another great example of ways to engage families through conversation and the data and how it can be used. Another slide, please. Liza, one more. This is another aspect, like the level 4 and 5 of the continuum, where you're looking at how can you engage and partner with parents and caregivers. The examples of the two resources that are here and also linked on the posted and linked to on the website for all of you are from NICHQ. If you're, working in the pediatric space is new to you, the National Institute for Children's Health Quality, NICHQ, has some great resources. This one on family engagement, the guide, and one specifically on how to create a patient and family advisory council. These are toolkits. They'll help you help the practice team assess practice readiness to be able to work with patient and family advisors and partners. There's no reason to reinvent the wheel. There are these and other resources available to you that you can test using at the practice level with parents and caregivers at the table as part of your efforts. I would advise that you and suggest that you download one of these resources, and we can talk about it more during next month's call. And on the next slide, just to point out that this is takes a team effort to do QI work. It's a team sport. And really important that parents and caregiver partners, patients, maybe even adolescent patients, are part of the team from the start, not brought in after the fact when you say, wait, we want to do some work and then we'll get the voice of the patient and family. No, don't be afraid. They'll give you so much good information and it'll be really valuable and worth the effort. On the next slide, I have some information that a colleague, Janet DeGeorge, was kind enough to share with me. She started as a parent partner and she's a national advocate now, and has some good advice about what, the reasons why it's important for a parent or caregiver to be on your team. And here they are, here are a few that are listed. And the sense of urgency, children are getting older every day. It's really important in this case. You want to be able to make sure that asthma care management is increased so that emergency room visits and hospital stays are decreased. And it's great having parents and caregivers because they're free agents. They're not tied to one agency or one philosophy, and they will tell you what they think and ask some of the hard questions. So I think that, and on the next slide, I know that there are some, the reality is that, those of you who have been trying to engage and partner with families, patients and families, it's hard work. It's difficult sometimes to keep them connected as team members, and volunteerism in general has its limitations, and sometimes just the idea of learning about quality improvement and how to do that work, there's a learning curve. But as I said, there are good resources, and through the next several months I will be happy to offer my support for those of you who are coaches, advisors, and practice teams, to work all together to be able to help make this happen. Because on the next slide, Janet says, and it's so true, it's really worth it all. It's worth it to everybody. It takes some time. You're moving towards, the goal is equal responsibility and equal partnership. So you want to, if you could just one slide back, I think, you need to be able to, there you go, to identify what's the scope of work if we're working with patients and families. You need to be clear about what you want them to do, and offer and have some concrete ideas of the work that you can do together, when to meet, how you can do it together. Maybe after you meet face-to-face, that virtual time, meeting time works. It's about planning ahead. Somebody really needs to be kind of assigned to work with the patient or family member, or members, even more than one, as partners on your team. And what are you going to do in between those meetings to make sure that there are roles and responsibilities, and everybody has work that they can do. So, and one way to do this, on the next slide, you see that there's, you can have, this is a great example, and again, is posted and available to you, an interview that's not an interview, to be able to talk with a parent or caregiver about, have them share their story, what the expectations are for their participation, share your story as a practice and as a team, and figure out, what's going to work so that they can be active members working as part of your team. And explain, what that's going to involve, and be able to meet their needs as well as yours. So on the next slide, here's an action step for you. I'd really suggest that in the coming next few weeks, meet, for the coaches and facilitators to meet with the team, including, you may already have some parents and caregivers involved. Identify some of those who have patients, children and families in families with asthma. See if, what do they need? What would help them improve their asthma management? Would they be interested in meeting with other families as part of a group, a support group? What time would work best? Plan this out as a test of change, not as a task, but as a test of change, and identify who's going to be involved in that, who are the clinicians and staff who are participating, when would it happen, where, what will it look like. You may want to think about educational content like gizmos and gadgets. It doesn't have to be the practice team or who are the only ones involved in this. Who are the members of the community, the Department of Health, another community-based organization who may do home visits, or asthma educators who can be part of this group to be able to engage these patients and families in being able to improve asthma management. Think about, too, are there some incentives that may help families be able to participate, transportation or child care. Maybe you want to schedule follow-up visits at the practice for asthma, patients with asthma for a certain afternoon, and in conjunction with that, they could stay and participate in this type of group. Because this group could be the beginning of your PFAC. your Patient and Family Advisory Council. As an established group within the practice that meets regularly, it involves patients and families, clinicians, staff, and it'll be able to help then, provide guidance to the practice on improvements in care processes and experiences. So starting with asthma and an asthma support group could be the beginning of your PFAC. Next slide, please. This is just another resource that you're going to find posted, and the link is at the end of the presentation. It's a piece of a change package or toolkit that we used recently in a American Academy of Pediatrics Family Engagement Quality Improvement Project. It is one of the many wonderful resources that this is a compilation of things that are available on the National Center for Medical Home Implementation website. So, in addition to what we've posted that's pediatric focused, I would encourage you to go to the National Center as well, because, the patient and family engagement it's about working on that continuum, so your practice or your practice teams can assess where they are now, what are the resources and tools that can help them move forward so that you can celebrate the success and the hard work of helping a team, including parents and patients and families, as part of that team, move towards really being engaged as partners. So now what I'd like to do is we're going to take everybody off mute, and if you can, we'd like you to be able to share questions, or, if you've had success related to patient and family engagement on the topic of asthma care, or, issues, challenges. Those of you who are coaches and advisors, if there are surprises or something important that you've learned, or your practice teams that you want to share on this topic, please do. If you could identify yourself when you start off, that would be terrific. Anybody want to start off?
Ruth, this is Liza. One of the issues that participants in this group identified when they registered was medication adherence. There were a list of issues that people identified as sort of their challenges, and probably med adherence was the top one. Appointment adherence, ED use overall, and sort of getting providers to work with guidelines were sort of the next tier of issues. But I wonder if you could talk a little bit about how person and family engagement might be used to work on the issue of medication adherence.
Great question, and yes, we did see that that's a hot topic, and that's why our June and July time together in particular, we want to be able to focus on different strategies to be able to help practice teams have those conversations with patients and families about, to identify and talk about medication management in particular, how it plays into the asthma action plan and planning and shared decision making, and even I think some of the strategies we're going to talk about next with teach back. One of the things I've heard from practices, from parents and families, is that they often, they may say to the physician, yes, they understand, but they leave the appointment and still have some questions, but they didn't want to share that because they felt that they should have understood. And so being able to use some simple strategy like teach back to be able to have the patient or the family member give back in their own words how to use, which medications to use and when, I think will help with that engagement and build that confidence in the relationship. So, you know, we will definitely talk more about that topic because it's so important.
Everyone's line should be unmuted now, so if you have a question or if you'd like to answer any of these questions here that Ruth asks of this group, we'd love to have you chime in.
Don't be shy. And please, if it's an issue or a challenge, with so many, you know, experts on the line here, you'll get some good feedback. So. I'm curious if anybody's had any challenges with, you know, getting families to come back for a visit, you know, for appointments when asthma management is going well, and yet they, you know, you or someone should be seeing them to monitor that. Any strategies that you're finding that are helping to build that, to make that happen more readily? Okay, then we'll make sure that we talk about that more moving forward. That was another topic that was brought up.
And we also have heard that some practices have access to their own data on who's going to the ED and some do not. So do you have strategies for identifying patients who are at risk or who have had an emergency visit? And can we use that information then to identify, you know, what tactics might work to engage those patients and their families more fully in the practice and the practice management strategy? Who has data or has challenges with data who'd be willing to share with the group? We've heard in one case getting data is difficult. Are others finding that true as well? That you don't have data that you're able to use then in a timely fashion?
So this is Rhys. I'm a practice facilitator for the TCPI grant in the Better Help Together region. One of the issues that my smaller clinics have is if they're not connected to the same EMR as the hospital, oftentimes those hospitals, if they determine who the primary care provider is, will fax in the fact that this person came into the ER for this reason, and that isn't always efficient because they aren't really checking their faxes. So that's an issue that we've had as far as the EMR's not communicating, at least here in my region.
Yeah, anybody find that they've been able to build that relationship with the ERs when they're not on the same system? I know I've had pediatric practice teams talk about how the physician or, you know, another clinician has actually, you know, gone on site, had a meeting with the emergency room director or nurse manager, you know, someone to be able to build that relationship, to be able to get that information for their patients when they're seen in the ER, because you're right, you know, the faxes don't always work or aren't, the system doesn't always work in a timely fashion. And they found that once they started establishing that relationship, that they actually got that information, you know, either they got calls in a timely fashion or that they figured out a way that worked for them. So have you thought about, you know, have any of your practices had any conversations with the ER in their community?
We have set up meetings, so we have certain things, you know, we've discussed, but there's nothing formalized yet.
Okay, well that might be a good test, you know, and then let the ER know how did they do, you know, and that may help, because often, you know, it's not fair to rely on the parent or patient or caregiver, and you want that they have to be the one to always be carrying that information from one place to another. So I think that be interested to hear how the meeting, whether or not you're able to they're able to establish a relationship, and it may be, if there are multiple ERs, start with one that either sees most of the kids or that you feel you could have the best relationship with to work out the kinks of how that would happen.
Thank you. I also put a question in the question box. I don't know if you guys are checking that.
Yeah, I was just gonna ask.
Okay,
the
great.
question has to do with encouraging and any tips on how to encourage clinics or practices to be able to put aside staff time to create and facilitate support groups. And anybody, any of you on the front lines have any tips that you actually have tested that are working for you? Okay, quite a bunch today. Okay, so a suggestion, something that I've actually, again, it takes time, but to be able to have if you identify who the staff, who's the person or maybe two people on the staff who are going to be helping to really work with the QI team, maybe to be able to create that first out support group that you want to hold, to be able to give them some protected time to do that work, so that it's not just in addition to everything else, to carve that out. And it may be, it's on an individual practice basis or clinic basis. Do you find that to ask, is it first thing in the morning? To be able to have that time, or if it's the support group, obviously specifically to be the facilitator for that, it really needs to come from the families that want to participate, because if you say, okay, here's when we're doing it, and then nobody shows up, then you're going to be disappointed, and so are they. But like I said, this is QI, so just test doing it. Ask a few families. It doesn't have to be a huge group. If you can get just a few and put aside, and allow that staff team to have some protected time to facilitate that, and it may be coming in, if it's an evening group, how can that be? Like if it's after hours, how can that person's schedule be juggled the next day or another day that week, to be able to accommodate that. But I just test it. One of the things that there's on I think the next slide, you're going to have failures. You're going to have failures, and there are going to be mistakes. But don't be afraid to just give it a try one time and see what happens, because you're going to really learn from that. Get feedback from those families and the staff members. So even if everybody's different, just have one of your practices, or maybe more than one, just come together as a team and test doing it. Have you done that yet, Rhys? Have you had a chance to do that?
No, one of the suggestions that I made was that I, as the practice facilitator, could use my time to help set it up, and help decide which patients would be best. But then if they saw a benefit to it, then they would have to then decide if that was worth their time. That's something that we're mulling around at this time. So the upfront time would be mine and not cost them.
Okay, well that sounds terrific. I mean, that may be your first test, is it that you're the one who does it, but and then if it works, to make sure, how do you mentor and figure out how, because at some point you're going to go away, and you want to make sure that it would be those type of wonderful engagements and partnerships continue. So offer it, but offer it as a test of change.
Yes.
Great idea. Okay, so we'll leave you with that.
The
I'm sorry, go
idea
ahead.
with this is Liza with PCPCC, and the idea really is that this group continues to come together and to develop action plans individually, but then come back each month and talk about what's working and what's not working, and hopefully driving towards this goal of improving asthma care and reducing emergency departments. So I know Ruth wanted to kind of leave us with some action plans. We've got some questions in the chat box about the website, and the last slide that we'll show here will give the website where all of the resources that Ruth showed will be up there along with the slide set. And I guess another question for this group is, would it be helpful in between this call and the June 20th call if either we have an office hours where Ruth is available to ask questions, or if people have the opportunity to send in emails and we can potentially respond individually and post things as a FAQ kind of list on our website. So, you know, we would like to have this group commit to action and to taking some steps like the ones that Ruth has been outlining. And we wonder what would be the most helpful to you in terms of helping you get that done and fit it into your everyday activities. Ruth, do you want to say anything more about this action step? I kind of jumped in a little bit.
Oh, that's okay. I think, you know, I mentioned it in response to Rhys. So all of the practice, the QI coaches and advisors, you know, to be able to go back and, you know, you may find that when you talk about the continuum with your practice team, that they're at level 3, and so you may start out, your action may be, they're not really ready yet. You know, use one of those readiness tools, and even for a PFAC, you know, it may take time to get to this point, but I, you know, like I said, there's, you can do simultaneous cycles of change, and so we really want to have you, you know, go back and talk about and plan and maybe even test by June 20th what that would look like. And so you can, even if it's at the plan stage, to talk about on the next call how that conversation and how that process went. Who did you involve? You know, what kind of information did you hear? What was the voice of the patient and family in planning an asthma support group? What did they say they wanted or needed, to be able, so others can learn from that as well. So I hope, we all hope that there'll be some information sharing on that area in particular, but even on the use of any of the tools, testing of any of the tools that we've just talked about today when we come together next month. Here are the websites. The PCPCC SAN website has, and Resource Center has wonderful information, and then specific information related to, you know, this network, Pediatric Asthma and PFE network, are posted at this site. So really appreciate all of your time and this afternoon, and really look forward to your input. This is your, you know, this is to support your efforts and hard work, and so please let us know what you need. We're happy to support you.
Thank you.
We will be sending out a follow-up email that has this link in it, but also we'll let you know how to access the webinar on June 20th. And we encourage you to kind of put a note in your calendar to take some of these action steps so that, you know, we'll be able to see what's working and what's not working and talk about those on the next call. So Ruth, unless you have anything else to cover, I think we'll close the call and
okay, I would just like to, one last thing, I would just like to thank Dr. Pararoyd for her great sharing of her experience and successes and challenges, and you know, being willing to be the first one up. That's always not easy to do. So thank you, Lilia, for your time and expertise.
It was a pleasure.
Okay, well, thanks everyone, and we'll adjourn, and we appreciate your participation on the call.
Thanks. Take care.